Thank you for joining us again today. First of all, I want to start by saying there are no new positive cases in Winnebago County. I know that the governor announced that there were 134 new cases in the past 24 hours throughout the state of Illinois and announced 3 deaths of Illinois citizens, none in Winnebago County. So I want to be clear that while we continue this, the efforts that everyone is doing on the social distancing have continued to help us flatten that curve. We keep talking about it and we keep working toward it. We have submitted, when people ask me about testing, and I'm going to go right off on this one, we are now at the state of Illinois, testing is being prioritized for people who are being hospitalized with what we call atypical pneumonia, and those individuals that are coming out of what we call congregate living situations, such as jails, nursing homes, congregational living, the homeless shelters, because they are our highest priority in the sense of at risk for coronavirus and COVID-19 and poor outcomes. Other individuals that require testing must first, again, call ahead before you go. You can use telemedicine. The governor announced expansion of reimbursement for telemedicine and telemedicine capabilities so that individuals, if they want to consult with their provider or caregiver, can do that before so that the whole first responder care team can be ready to receive you in that system. Those tests that are being done are sent to our private laboratory systems, such as a LabCorp or a Quest. As of today, we have submitted what we call 38 specimens of people at risk. We continue to report 1 positive. We have 16 negative results have come out of the system, and 24 are pending. 82 are in the LabCorp system, and that's through the work of all our health system partners who are reporting that to us voluntarily on the number they're submitting to private. So we continue to get a sense of what is happening in our community. With that in mind, with the number of cases increasing, we have begun to expand our social distancing and mitigation recommendations. So now we are limiting crowd groups of gatherings to no more than 10. We are reducing from 25 to 10 and maintaining that 6 feet of social distancing. Now, people will ask, does that apply to me? It does not apply to businesses. It does not apply to daycares, which are still operational, but daycares are not accepting new enrolled children. Why? Because we talked about that earlier in the week, keeping their cohort together. They are not to be an alternative to school care. We talk about some of our businesses. They are able to maintain that 6 feet of social distancing on their footprint within that space. But as we go through this, we're going to continue to put and heighten those standards so that we can ensure that we are maximizing what we call those social mitigation strategies so we can help the community stay as safe as possible. Over the week, we had a lot of calls, I'm going to call about personal care, barbers, hairdressers, body art establishments, massage, nail salons. We are asking that they suspend services. Why? Because they can't maintain 6 feet of social distancing as part of their routine service. They must get within a certain level of space to be able to perform the services they provide at the high level that they do. We know that this is going to be difficult for individuals. We understand, but we have to continue to enforce and begin that process of really encourage that social distancing so that we don't place the establishments at risk and the people they serve at risk. So that's the next step on all of this. Daycare centers will continue with providing care, especially to our first responders. We want our healthcare workers to be able to provide the care that they need, but they will not be taking new enrollments. Across the nation, elective surgeries, including all our 3 hospital partners, have agreed to delay or suspend elective surgeries and procedures so that they can begin to conserve the supplies, the equipment, and reserve for staffing to be able to care as the disease of COVID-19 begins to expand in the community. We want our systems to know that we are behind them to help prepare. They continue to provide testing, but again, call, seek your medical care provider guidance before. You may be instructed, even with symptoms, to stay home if you have a mild case and recover at home, and only seek medical care from an emergency department if your symptoms worsen or become severe that you need emergency care. We cannot emphasize that enough. We've got to make sure that we support our healthcare system so that they are able to conserve both resources to provide care to individuals most at need. I want to thank the community so far that has really done a tremendous job to help us in addressing these concerns and issues. They have been maintaining social distancing. They've been calling and asking questions about how can they make their environment safer. We understand this is a very difficult and stressful time for all. We want you to know that we are backing you up. Our healthcare systems are ready to care for those most critically ill that need the care and support, and to test those who require testing. But we need everyone, if you get nothing else, but call first before you come. Use your telemedicine. They will advise you appropriately. If it's an emergency, you will then be taken through the emergency system process. Help our healthcare providers conserve the resources they need to be able to provide care to the most critically ill. If you have questions, we still want to remind the public to call the Illinois Department of Public Health hotline at 1-800-889-3931. And again, for specific questions to Winnebago County, which many of our community members are calling and asking, should I be able to do this? Can I do this? What do you think about that? We have it from our Emergency Operations Center, which is that big team behind me, way more than 6 feet away from me, that's backing us up and really helping to answer all those questions. Their number is 815-319-6705, and they're available Monday through Friday from 9 to 5. So again, I want to reconfirm, there are no new cases in Winnebago County. We continue to see a number of cases in Illinois increase, and we continue to ask our community to monitor the situation and to comply with the directives of social distancing, keeping group sizes down to 10, and following up with medical advice from their providers should they become ill while at home. Thank you.